Welcome to the Trust's oral paracetamol video. This has been recorded on behalf of the UHCW Sustainability Group, Saving Turtles. My name is Ambreen Yassin and I'm one of the anaesthetic registrars, and I'm making this video alongside Dr. Laura May, one of the consultant anaesthetists, and Dr. Elaine Yip, another one of the anaesthetic registrars. First of all, I would like to start off by saying a really big thank you to Layla Moore, one of the Trust's pharmacists, for helping us gather the data that's been used throughout this presentation, especially the data on usage and costings. So sustainability, why is it important? Well, what we have done in the past just hasn't worked. In the last few years alone, we have seen more and more extreme weather patterns, the majority of which have been record-breaking. From monsoon rains flooding a third of Pakistan, causing widespread disruption and displacement of a large proportion of the population, alongside an increase in disease, to the melting of glaciers, seen in more countries worldwide and at a faster rate than ever before. Some of these countries have historically not been as affected by climate change, but have contributed more greenhouse gases than others. And the record-breaking heat waves affecting multiple continents, from Europe through to North America and the Far East. Throughout this presentation, I'll be using some specific terms related to sustainability, one of which is the carbon dioxide equivalent, or CO2e. This measurement is used to compare different greenhouse gases and the effect they have on the climate. For the purposes of this presentation, for every mile that you drive either in a petrol or diesel car in the UK, you'll produce the equivalent of around 219 grams of carbon dioxide. And this is the figure that we've used in order to equate all of our distances. Overall, the NHS as a service has a huge impact on yearly CO2 emissions within the UK. Looking at total emissions over the course of a year, we produce around 5%, which in itself probably doesn't sound like very much. But for every pound that is spent in the NHS, we produce on average 170 grams of CO2. The annual budget for the NHS in 2019 and 2020 was £134 billion, which means that the total CO2 equivalent works out at 57 billion miles driven by an average car. And that is the same as driving around the solar system almost 6.5 times. The pie chart on the slide shows the specific sources of these emissions within the NHS, some of which I don't think are particularly obvious and some of which I think are out of our control. But they vary widely, looking at emissions from how we all commute into work, through to the medications we administer, and specifically the ones we prescribe to patients for them to take in the long run, alongside the amount of waste that is produced throughout the NHS and how we get rid of that waste. In order to combat this, the NHS is working towards being the first global net zero national health service, and they've done that by splitting those emissions into ones that we can control directly and ones that we can have an influence on. For those we control directly, so that would be things like the medications we prescribe or the medications that we choose to use on a day-to-day basis, they've set a target for reaching a net zero by 2040, but they're aiming for 80% of that reduction to have occurred between 2028 to 2032. For those emissions that we can influence, they have set the net zero target at 2045, again with 80% of that reduction between 2036 to 2039. And that would include things like the sources of electricity we use, how we transport medications around, and things like teleclinics. There are initiatives that have been put into place to start that process off, such as introducing electric patient buses rather than having petrol or diesel buses in order to link up to local public transport. Also, the use of drones in order to start transporting medications across the country in order to be able to reduce emissions from that perspective. So getting to the crux of the matter, why should you choose oral paracetamol for your patients? Current evidence shows that oral paracetamol has got a similar analgesic efficacy as intravenous paracetamol. It's quicker to administer, only requiring the one nurse to administer rather than a two-nurse check. There are also benefits in terms of cost savings, and overall it is much more environmentally friendly. Another common use of paracetamol is as an antipyretic, and there is evidence that favours intravenous paracetamol for a quick reduction in pyrexia, but that quick reduction was clinically insignificant after 4 hours. Having said that, the evidence base for looking at the difference between intravenous and oral paracetamol for pyrexias was far, far smaller than that for analgesic effect. And predominantly all of these studies were in paediatric populations, of which you could argue is that suitable to extrapolate to a wider population. Looking at administration greatly favours oral paracetamol over the intravenous route. And that's because, as I mentioned before, it can be administered by a single nurse rather than two, as it doesn't require a two-nurse check. And that can affect the nursing workload that you have on the ward, or it means that actually that patient could self-administer that medication, taking that workload away entirely, as long as it's been documented. Patients can then receive analgesia when they don't have intravenous access, so it takes away that thought of how much waste is produced between needing the cannula and not requiring the cannula. And there is also the significant difference in the amount of waste produced between oral and intravenous paracetamol. And talking about waste, these pictures give you a comparison between administering a gram of intravenous paracetamol on the left-hand side versus 4 doses of a gram of oral paracetamol on the right-hand side. You can see the amount of waste that is produced through inserting a cannula using the cannula pack, and that waste is extended to the actual giving set that is required alongside the actual plastic packaging that the paracetamol comes in. And this is compared to the blister packs themselves, which contain 4 doses of paracetamol for one patient, or 1 dose of paracetamol for 4 patients. So arguably, to equate it, I should have actually included 4 times the amount of waste pictures on the left-hand side than the right. There's then the associated cost savings associated with administering paracetamol in different ways. So 1 gram of paracetamol intravenously, including the giving set, is over 100 times more expensive than its oral counterpart, with the drug itself being almost 60 times more expensive than oral paracetamol. And that would work out at being over £1 per dose. For some patients, they can't tolerate oral tablets, and so you might think about either dispersible or liquid preparations. And that still represents a cost saving at about 1/3 of the cost of intravenous paracetamol. So either way, we should really be looking at how we're giving that paracetamol to patients. And looking at a 4-year time span, specifically within UHCW, between 2018 and 2021, we can see that we've administered over 106,000 doses of paracetamol, in comparison to only 12,500 doses of oral paracetamol, and that's a 90% preference of intravenous paracetamol use versus oral paracetamol use, of which a significant proportion could be reversed. And to try and understand this further, we've looked at exactly where that intravenous paracetamol use is, so that we can see whether it was necessary or not necessary. This is looking over the last year, and understandably, the highest use was in critical care areas if you take general and cardiothoracics together, totaling at about 1,400 doses. Another high usage area was the post-operative ward, so Ward 10 ECU had around 800 doses, with the surgical assessment unit having over 1,100 doses of IV paracetamol. Theatres, which includes the recovery area for the purposes of this, used around 580 doses, and these were by far the 5 largest using high usage wards that we found. So financially, with our current usage of IV paracetamol versus oral paracetamol, we spend around £63,000 on IV paracetamol, which if we were able to convert that to oral paracetamol, we would be able to save over £60,000. And imagine what you could do with that money. Another big focus is looking at the environmental impact that we can have. So looking at the CO2 equivalent of IV paracetamol, in order to get a total idea, you have to look at the life cycle of that drug. And that includes siting the cannula with the plastic packaging associated with that, through to the actual packaging of the paracetamol itself, which we know produces around just over 16.5 tons per year. After that, we have to then think about how that plastic needs to be gotten rid of. Generally, that's through incineration because it's contained a medication, and that by itself produces a further 9.6 tons per year. And before we can even use it, that paracetamol has to make it to the hospital. So there's also a small amount of carbon produced due to the cardboard waste associated with that paracetamol. And this isn't even taking into account the manufacturing process of it. And looking at that packaging, this photograph shows the difference in the amount of packaging required to treat 100 patients with 1 gram of paracetamol. And as you can see, there is a huge difference. So based upon our use of intravenous paracetamol, we produce around 28 tons per year of carbon dioxide equivalent, and that equates to driving over 100,000 miles or flying a return flight from London to Perth 7 times in a year. Now, I don't know about you, but I don't know many people that would be doing that trip 7 times within a year. We have to then look at if we were to convert all of our IV paracetamol to oral, that in itself would have a little bit of a carbon dioxide cost. But as you can see here, if we converted all of our IV paracetamol to oral, we would produce around 2 tons per year, and that's a reduction of around 27 tons of carbon dioxide, or a 14 times reduction in our carbon dioxide production. And that's only looking at one drug. So what is the way forward? How are we going to proceed? We would suggest that oral paracetamol should be used in all patients unless it's specifically contraindicated. That would include the preoperative nil-by-mouth fasted patient, who ideally should have some analgesia on board preemptively. If your patient is unable to tolerate oral paracetamol, please think about what alternative enteral routes we could use, whether that's using a dispersible tablet or a liquid preparation to go down an NG or an NJ, for example. And that having an operation shouldn't be an automatic indication for post-operative intravenous paracetamol. As long as they have an intact GI tract, oral paracetamol is just as good as IV. If this talk has increased your interest, there are other ways that you're able to help. All prescriptions should only have one route of administration, so we should avoid prescribing oral/IV on the drug card. When we're citing a cannula, please review the waste that we've produced and look to see if there's any waste that can be recycled. If there isn't any waste recyclable, are we using the correct bin to dispose of that waste? Have we thought about powering down at the end of the day and switching off all the lights and computers that aren't going to be used overnight? Basically, exactly as you would do at home. And overall, for medical staff, sustainability may form a part of curriculum requirements, as it has within the last rewrite of the anaesthetic curriculum. So think of a project in your local area and please get involved. This is a list of the teams so far involved in UHCW's Saving Turtles. As you can see, it includes a wide variety of both medical specialties and non-medical specialties, all of which can do their bit to helping with sustainability. And this gives you an idea of all of the projects we've got involved with. So to pinch a phrase, every little helps. So please help. Come join us and help us reach all of those targets we've just been talking about. If you have any questions, or if you need help with getting projects off the ground, please get in contact with your local Saving Turtles member. There's normally one available for each area, and if you can't find out who that person is by asking around, please get in contact with elizabeth.fitzhugh@uhcw.nhs.uk. Thank you for your time and thank you for listening. It's really appreciated.